السلام عليكم ورحمة الله، ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة الاختبارات Parametric Review of Parametric Test Question. Today, inshallah, our question about chest tube management. We're going to discuss 10 questions from question number 24 up to question number 33. معكم محمد الثمانية. نبدأ مباشرة. Question number 24. A nurse is transferring a patient with chest tube to the X-ray department for chest X-ray. Which location should the nurse place chest tube? The options are: number A, directly on the stretcher in an upright. Number B, on the side of stretcher next to patient. Number C, hang it on IV pole that is attached to the stretcher. Number D, attach it to the stretcher and hang it. وقف الفيديو هنا واختار الخيار اللي تشوف صحيح. The correct option is option number D, which is attach it to the stretcher and hang it. ليه اخترنا الخيار رقم D؟ نشوف rational. The chest tube or chest drainage system must be lower than the chest to facilitate drainage and prevent backflow. So the correct option is option number D. Attach it to the stretcher and hang it. Regarding to the option number A and B and C are incorrect because chest tube should never be at the same level or above the patient chest. So the correct option is option number D. Question number 25. 69-year-old man is admitted to the intensive care unit following cardiac surgery. 2 hours after admission, the nurse performed a routine assessment and notes the patient chest tube drainage is 200 milliliters and dark red color. He has had 60 milliliter output from the indwelling urinary catheter. Blood pressure of 138 over 68 mmHg. Heart rate is 76 beat per minute. Respiratory rate is 16 breaths per minute. Body temperature is 37 centigrade by oral. Oxygen saturation is 94%. The patient on 6 liters of oxygen per minute through the nasal cannula. Which finding should be reported to the doctors? The options are: number A, dark red chest tube drainage. Number B, urinary output. Number C, oxygen saturation. Number D, chest tube output volume. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number C, which is oxygen saturation. ليه اخترنا الخيار رقم C؟ نشوف rational. The nurse should inform the doctor about low oxygen saturation because the normal level of oxygen is usually 95% or higher. So the correct option is option number C, oxygen saturation. Regarding to the option number A, dark red chest tube drainage is normal and good indicator because drainage that red and free flowing indicates a hemorrhage. Regarding to the option number B, urinary output also normal because the normal urine output is 0.5 to 1.5 cc per kilogram per hour. And regarding to the option number D, chest tube output volume is normal. ليه normal؟ because the chest tube drainage of 200 milliliters in 2 hours following cardiac surgery is normal. لكن إذا كانت chest surgery بيعتبر abnormal. Question number 26. 40 years old man patient has a chest tube and properly fixed following cardiac surgery. The chest tube is patent and functioning. When the nurse removes the dressing, the tube falls out of the chest. Which is the most appropriate initial intervention the nurse should take? The options are: number A, reinsert the chest tube and notify the surgeon. Number B, apply an occlusive dressing to the insertion site. Number C, place the open end of the tube in 200 cc of water. Number D, administer oxygen at 10 liters per minute via non-repressing mask. وقف الفيديو هنا اختار الخيار اللي بتشوف سهل. The correct option is option number B, which is apply occlusive dressing to the insertion site. ليه اخترنا الخيار رقم B؟ نشوف rational. If the chest tube is pulled out of the chest accidentally, pinch the skin opening together and apply an occlusive sterile dressing. Cover the dressing with overlapping pieces of 2 inches, 5 cm tape, and call the healthcare provider immediately. So the correct option is option number B, which is apply an occlusive dressing to the insertion site. Question number 27. While attempting to get off the bed, a patient accidentally disconnects the chest tube from the pleurovac drainage system. Which of the following actions should the nurse take first? The options are: number A, insert the end of the chest tube in a container of sterile solution. Number B, raise the end of chest tube above the level of insertion of the chest tube. Number C, clamp the chest tube near pleurovac drainage system. Number D, apply pressure dressing to chest tube insertion site. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A, which is insert the end of the chest tube in a container of sterile solution. اخترنا الخيار رقم A نشوف rational. If a chest drainage system is disconnected, the nurse can place the end of the chest tube in a container of a normal sterile saline to prevent air from entering the chest tube, thereby preventing negative respiratory pressure. So the correct option is option number A, which is insert the end of the chest tube in a container of sterile solution. Regarding to the option number B, raise the end of the chest tube above the level of insertion of the chest tube is incorrect because chest tube should never be at the same level or above the patient's chest. Regarding to the option number C, which is clamp the chest tube near pleurovac drainage system, the nurse should not clamp the chest tube. Because doing so increase the risk of tension pneumothorax. Regarding to the option number D, which is apply pressure dressing to the chest tube, the nurse should apply an occlusive dressing if the chest tube is pulled out and not if the system is disconnected or broken or so on. So the correct option is option number A. Question number 28. The nurse is caring for a client who has just had a chest tube attached to the water seal drainage system. To ensure that the system is functioning effectively, the nurse should: number A, observe for intermittent bubbling in the water seal chamber. Number B. Flush the chest tube with 30 to 60 ml of normal saline every 4 to 6 hours. Number C. Maintain the client in an extreme lateral position. Number D. Strip the chest tube in the direction of the client. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A. ليه اخترنا الخيار رقم A؟ نشوف راشن. Gentle bubbling, not excessive, should be noted in the suction control chamber, which is indicators or indicate air drainage from the client and usually is seen when intrathoracic pressure is higher than atmospheric pressure and may occur during exhalation, coughing, or sneezing. So the correct option is option number A. Regarding to the option, the remaining options are incorrect and inappropriate. Question number 29. A client chest tube is connected to a chest tube drainage system with water seal. The nurse noted that the water seal is fluctuating with each breath that client takes. The fluctuation means that, number A, there is an obstruction in the chest tube. Number B, the client is developing emphysema. Number C, the chest tube system is functioning properly. Number D, there is leak in the chest tube system. وقف الفيديو هنا واختار الخيار شو صحيح. The correct option is option number C, which is the chest tube system is functioning properly. ليه اخترنا الخيار رقم C؟ نشوف راشن. Fluctuation of water in the tube in the water seal chamber during inhalation and exhalation is expected. دي شيء متوقع. It means the chest tube system is working properly. So the correct option is option number C. The chest tube system is functioning properly. Regarding to the option number A, there is an obstruction in the chest tube. An absence of fluctuation may indicate that chest tube is obstructed. إذا ما لقينا حركة بتاعت مياه up and down نتوقع إنه يكون في obstruction أو that lung has re-expanded and that no more air is leaking into the pleural space. ولا الرئة حصل له انتفاخ بصورة كاملة وبالتالي الchest tube الوظيفة تبعه انتهى. فبالتالي ما هيكون في fluctuation. المفروض بعد ده should be removed. طيب. Regarding to the option number B, the client is developing emphysema. Emphysema indicate poor tube placement. في خطأ في تركيبة الأنبوبة. Regarding to the option number D, there is leak in the chest tube. إذا كان في leak في chest tube هيكون في continuous bubbling and excessive. ودي بيشير إلى إنه في leak or air leak in chest tube. So the correct option is option number C. Question number 30. Your patient has a chest tube. You are assessing the water seal chamber and you note that the water moves up as the patient inhales and then move down when the patient exhales. What may be causing this to happen? The options are number A, this is normal and expected. Number B, the chest tube has a leak. Number C, the left chest tube is occluded. Number D, the water seal section should be increased 2 to 5 mmHg. وقف الفيديو هنا واختار الخيار. شوف سهل. The correct option is option number A. This is normal and expected. اللي اخترنا الخيار رقم A نشوف rational. Movement of water in the tube in the water seal chamber during inhalation and exhalation is called fluctuation or tidling. and it is expected and normal. So the correct option is option number A. This is normal and expected. Question number 31. You are assisting a MD with the removal of chest tube. What activity may the MD have the patient perform while the chest tube is being removed? The options are number A, Valsalva maneuver, number B, Lipold maneuver, number C, chest physiotherapy, number D, half cuff technique. وقف الفيديو هنا واختار الخيار بشوف سهل. The correct option is option number A, Valsalva maneuver. ليه اخترنا الخيار رقم A؟ نشوف rational. When the chest tube is removed, the client is asked to perform the Valsalva maneuver اللي هو take a deep breath and exhale and bear down. The tube is quickly withdrawn and an airtight dressing is taped in place. So the correct option is option number A, which is Valsalva maneuver. Alternative instruction is to ask the client to take a deep breath and hold the breath while the chest tube is removed. دي طريقة آخر برضو يستخدموه في إخراج أنبوبة الصدر اللي هو المريض ياخذ نفس عميق ويكتمها وفي الوقت يتم إخراج الأنبوبة وبعدها ينتهي. طيب. Question number 32. A 67-year-old man is admitted to the post-anesthesia recovery unit following chest surgery. The patient has a right chest tube that is attached to low suction. 3 hours after admission to the unit, the nurse observed the drainage output from the chest tube is 300 milliliters. What is the most appropriate initial intervention? The options are number A, notify the doctor. Number B, reduce IV infusion rate. Number C, strip tube with roller device. Number D, reposition in left lateral decubitus. وقف الفيديو هنا واختار الخيار اللي تشوف سعيد. The correct option is option number A, which is notify the doctor. ليه اخترنا الخيار رقم A؟ نشوف rational. The chest tube drainage following chest surgery. في فرق طبعا بين الدرينج بتاعت الchest surgery general chest surgery and cardiac surgery خاصة في الاوتبوت في الناتج تبعه. Following chest surgery should not exceed 70 ml per hour. And the nurse should inform the HCP or healthcare provider if drainage exceeds 70 ml per hour or if the quality of the drainage change to frank blood or free blood. So the correct option is option number A, which is notify the doctors. Question number 33. The nurse is caring for a client who has had a chest tube inserted and connected to water seal drainage. The nurse determines the drainage system is functioning correctly when which of the following is observed. The options are number A, continuous bubbling in the water seal chamber. Number B, fluctuation in the water seal chamber. Number C, suction tubing attached to a wall unit. Number D, vesicular breath sound throughout the lung field. وقف الفيديو هنا واختار الخيار بشوف صحيح. The correct option is option number B, which is fluctuation in the water seal chamber. ليه اخترنا الخيار رقم دي؟ نشوف rational. The water in the water seal chamber should rise with inhalation and fall with exhalation. This is called tidling or fluctuation, which demonstrates that the chest tube is better and working or functioning effectively. So the correct option is option number B, which is fluctuation in the water seal chamber. If there is no tidling or fluctuation, يعني هيكون في شنو إذا ما في tidling ولا في fluctuation. Consider number one, an occlusion somewhere between the pleural cavity and the water seal. نتوقع إنه في قفل أو full expansion of the lung ولا الرئة حصل لها تمدد كافي وبالتالي تالي ما في air leakage عشان يدي فرصة بتاعت move up and down بالنسبة للسوائل في التيوب. So the correct option is option number B. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.